for joining us for this episode of Inside Town Hall. I'm your host, Madeline Shields. Sioux Falls is growing, and with the increased population, that means a need for more human services. And here to update us on The Link, a new service to help people with substance use disorders, we have City Councilor Marshall Selberg, and his guests are Alicia Colura, who is the Assistant Director of Public Health, and Steve Linguist, who is the Project Director for The Link. Thank you all for joining us. Let's talk a little bit about what The Link is, if people haven't heard of it before, or they may have heard it called the Triage Center.
Right. Well, we've been very excited about this for quite some time, and that's why I thought we'd have Steve and Alicia in today to talk about it. I know it's been the topic in the community for months now, and I think we're sneaking up here in just a couple of weeks. We're going to finally open. So I thought we'd maybe cover that today, and I'll let Steve and Alicia talk a little bit about it, and we'll just go from there.
Okay. Tell us a little bit about your position as the Assistant Director of Public Health.
Yes, I'm the Assistant Director of Public Health for the City of Sioux Falls, and I'm on the project team for The Link. The Link has a board that comprises of Sanford Health, Avera, City of Sioux Falls, Minnehaha County, as well as the Helmsley Foundation, and we each have membership on what's called the project team. So the project team has really been tasked with operationalizing The Link for our community.
Okay. And Mr. Linguist, tell us a little bit about what your role has been with The Link.
I've been project director since February of 20, so I've been on board for a while, and my role basically has been to work under the board's direction to get the program up and running. That includes the design of the interior of the location where we're going to be, along with finding someone to run the programs and different things like that. So a lot of it's concerned the actual construction as well as programming.
So for people who may not know, The Link will help people who are suffering from mental illness or substance use disorder. Talk a little bit about why it's so important to have this facility now.
Well, I think it's, as far as addiction, mental health, I think it's been out there in a topic of discussion and a problem for as long as we can remember. And we've got people where they're heading to the emergency room, or people going to different areas for help sometimes, where this is going to help that kind of the flow into those areas. As far as addiction and mental health, it's something, again, we'll talk about some other programs and that as we talk about The Link today too, but I think there are people out there both, from all walks of life that have needed some assistance. They've needed some things like this, some easier ways to get some help, and I think that's what we're looking at today. And again, that's why I'm thinking Steve and Alicia will open some doors and tell us about what exactly The Link will do, and we'll go from there.
Sure. Let's start there. Once it opens, what can people expect to see, or what kind of treatments will happen there?
So we really want The Link to be kind of that answer to the question of where do I turn for help. That's something that we at the health department will see through our community health needs assessment. We know Mayor Paul Tenhagen has talked about constituents really asking that question of him, and we know that we already have a very excellent continuum of care in this space in our community, but sometimes we still see barriers with people needing immediate access to care. So we're hoping that anyone in our community can feel comfortable to walk through the doors of The Link, ask for help, and the three primary services that we will be providing, or that will be provided through The Link, is psychiatric acute care. So we will have 3 dedicated spaces for people to come in and be stabilized. We will also have 12 private rooms where people can come in and detox from drug or alcohol abuse, and that will include medical management of detox. And then we will have an area with 8 to 9 beds for observation unit for people who are sobering.
And you'll be able to have, what, up to 23 people at one time?
23 people at one time.
Okay.
What kind of staffing do you have at this, or will have at this facility?
Since it is a medically managed detox, we will have some primary care providers on site. And I believe advanced practice providers, as well as registered nurses, and also case management will be provided through a partner organization.
Steve, tell us a little bit about what your role has been through project management. You know, you take this from bare bones to now with the 23 people who can be treated at one time. You know, what does that look like? What was the process going through that?
Sure. The vision for this program actually started about 9 years ago, and it's evolved over time, but I think there were some key folks in the community who saw a need for a program like this, and it has, as I said, changed over time. One of the things that when I was interviewed by the mayor and Commissioner Dean Karski, County Commissioner, I had some questions about how does this fit in the array of services that are offered in Sioux Falls, because there are a lot of services in this community, in this region. And one of the things the mayor mentioned to me specifically was that he said when he has public listening sessions, what he hears are two things typically, affordable housing and behavioral health. And people don't know where to go for behavioral health. And that was kind of stunning to me, frankly, to find in our community people really didn't know where to go. But the more I've talked with people like Alicia, Carrie Benz from County Human Services, yeah, people often don't know where to go. And so it was taking those original ideas about what is a triage center and then shaping them to the needs here in Sioux Falls. And from there, it became, let's find a vendor, a provider, because the board didn't want to run FTE, they didn't want to run programming, they wanted to hire someone to do that. So it was a matter of working with Alicia and the project team to come up with an RFP. We issued that. Avera was selected as the vendor. And then from there, simultaneously, we started designing the interior of what was the city annex building, first floor of that, to shift it over from being a home for the city IT department to becoming the link. So that's been the journey here, and we're finally at the point where we're getting ready to open.
You know, this is going to be part of the answer for people who maybe have adult children facing addiction or teenagers facing addiction, and they're not sure where to go or what to do. What's the process going to be? Do you have the you know, a process, like what do they do? Do they call? Can they just show up?
You know, either one of those methods will work. Primarily the link will serve adults, but they will have workflows in place that if someone under 18 comes to the link, they'll be able to find the next best place for them. But we do anticipate that some patients may arrive through law enforcement. We anticipate that some will arrive by ambulance, and then we also do believe that we will see an increase in walk-ins. And just as you said, we hear stories about people who have family members in crisis, and you know, we continue to hear the question, where do I go for help? Where do I take my you know, neighbor, my friend, my relative for help? And this is where they're going to be able to walk in anytime and get the help that they need.
It was before, a lot of people were just going to the emergency rooms at either hospitals. Why is this an improvement?
Well, this is an improvement because this, in addition to the existing detox services that we have in this area, this will add a medically managed component, and that will allow our ambulance to utilize this as a place where patients can come rather than the emergency room. We know that the emergency room resources are scarce, so we always want to make sure that the patients arriving at the emergency room are appropriate for that utilization of services. We also feel like this will be care tailored to individualized patients, and so the care will be individualized, it will be the appropriate level of care, and it will be less expensive across our system to have patients utilize the link rather than emergency rooms or the jail or the justice system.
Right, because now, you know, there currently is not a detox facility now. I think it used to be in the jail, and now they are going to the hospital for those services. This will improve with well, people who don't have insurance and they can't afford to even go to the hospital, and now they're being taken there. Will this help?
Yes, this should help. It really should help anyone with or without insurance. You know, there are people who do have insurance that maybe have a deductible that's hard for them to pay, or a copay that's difficult. And so the link will serve anyone regardless of ability to pay. And we expect to see a mix of patients, whether it's from emergency rooms, possibly the justice system, or walk-ins, you know, people from neighborhoods as well.
Yeah, they're thinking it'll reduce emergency room visits by maybe up to 25%. So,
Sure,
yeah.
sure. And that cuts down on cost on people who cannot afford to pay those bills. Yes, okay. Okay, and now we have Operation Hope Fund. Let's talk a little bit about what that is.
Well, what we did with that, funds were given to the community of Sioux Falls, the state of South Dakota, and the community of Sioux Falls, you know, government funds for COVID. What we discussed over the last few months with the administration and amongst ourselves and the council are different ways that those funds could be used and utilized. And what we came up with was, one of the ideas was this Operation Hope Fund. And I think even before COVID, this again, as we talked about earlier, addiction, mental illness, that type of thing has been a problem that's, you know, been growing just almost out of control even before that, and I think it's gone nuclear, especially since COVID. So we were hoping to take some of those funds and put it towards this too, and tie it in with the link. And what we're doing is we're looking for people that have maybe been out there for quite some time and thinking of a way to step forward and ask for help, and again, weren't sure where to go or what to do. And there might be people that aren't coming forward because of financial reasons. There might be people that aren't coming forward because of stigma, because of pride, because of whatever that might be. But we're hoping that by promoting this and tying this in with the link and taking some of these funds, we're going to give people finally some hope and some inspiration to take that step that maybe they've been thinking about for quite a while. So we're working out some of the details on just how the program will work exactly, but that will be coming out in the next few weeks. But again, we're just hoping to give a message to people out there that if you're looking for help, if you've been waiting for an opportunity to step forward, waiting for the time, well, the time might be right now. So we work together as a council with the administration and the team, with the Link Project Board and team here to kind of put a program together that we're implementing here in the next few weeks.
Sure. So when someone comes into the link, can you describe what the process might be? And then it's not just a detox service, and it's aren't you to help find other resources that will get people maybe back on track?
Yeah, I can touch a little bit about that. So as people arrive into the link, they will go through a standardized screening process, and then their needs will be triaged from there. We expect that some patients may be there as little as 7 to 9 hours, but as long as up to 3 to 5 days. Each patient will have an individualized treatment plan, likely a case manager to help them navigate other parts of the healthcare system. And I think, you know, what Counselor Selberg would like to see is that through the use of Operation Hope, when needs are found through that screening process, that we're able to meet those needs with these funds and really just eliminate all barriers. We don't want transportation or a copay or a lack of the ability to maybe pay your deductible for psychiatric inpatient care. We don't want to see any of those barriers for patients, and really that's the purpose of the fund. And I think they'll find a lot of barriers when they do that standardized screening process, and then they'll be able to tap into this fund to help overcome those.
And we kind of modeled this after the One Sioux Falls Fund, where people came for rent assistance a year ago when COVID came in, and it was a very pretty much expedient program where people would come and ask for help. A decision was made pretty quickly and get them on their way. That's the idea behind Operation Hope too, where if people are stepping forward, let's get them in the right direction, a warm handoff to where they need to go. So, and it's going to be discreet, it's going to be, again, quick, and get people on their way. So.
Sure, and we're talking about things like not just medical supplies, it's hygiene items and food and you know, other things that people might need. They may come in with no shoes on. Are you asking at all, because I can't imagine these funds are going to stick around forever, with people who need help, those funds will be depleted. Will you take any donations, or how will that work?
Absolutely. Right now, our dollars are set up through the Sioux Falls Area Community Foundation. So we have a fund there, and people can contribute to that and designate it for these types of services. Also, they can contribute to the overall operation of the link itself or some subcomponents of that. So there are opportunities for charitable donation towards the facility.
In your planning throughout this, and I know it started, basically 9 years ago, and mental health and addiction have become more prevalent as our population grows. How many people are you expecting to help a year, even maybe the first year, and then are you thinking it's going to grow after that?
We think that we're going to use all the beds very quickly. And a lot of it's going to depend upon the turnover of those beds, how long people end up staying. So there is a plan in place that if we find that we open and we're busy to the point of reaching capacity fairly soon, that we might be able to expand the program into the second level of that same building. And there were dollars set aside by the state of South Dakota, introduced by local Sioux Falls area legislators that passed, that sets aside $3 million for the link. Not necessarily all for operations, but for potential expansion into that second level and for security enhancements if they're needed.
Well, thank you all for joining us for Inside Town Hall. Coming up next, we're going to learn who is benefiting from the CARES Act and the American Rescue Plan. We'll be back in just a moment.
Hello, my name is Dr. Zuzelski with Falls Community Health, and I would like to talk to you about the COVID vaccine. The vaccine has been shown to be over 90% effective at decreasing symptoms and hospitalizations when it is successfully administered to the population. Both the Pfizer and Moderna vaccines require 2 series of injections separated by 3 or 4 weeks depending on which vaccine you receive. People at highest risk for having severe adverse reactions from the vaccine are those who have allergies to previous injectable vaccines. Most common adverse effects are pain at the injection site, as well as fever, body aches, and headaches. All vaccination sites will monitor you for 15 to 30 minutes after you have been vaccinated in order to make sure that you do not have any serious adverse reactions. For more information about the COVID vaccine, please go to covid.sd.gov.
Welcome back to Inside Town Hall, where we are visiting with City Councilor Marshall Selberg. And on this segment, we have Shawn Pritchett. He's the Finance Director for the City of Sioux Falls. Welcome. We are going to talk about the CARES Act funding. Let's talk a little bit about how Sioux Falls has benefited from this money.
Yeah, we get a lot of questions on this as a council as far as how much did we get in funds, when did it come, what can it be spent on, what can it be spent on. So I thought we'd spend a few minutes today just maybe clarifying some of that. So we had Director Pritchett come in, and he can school us a bit on some of this.
Sure. So last year, I think people were very familiar with the CARES Act, and the CARES Act had a lot of different programs in it, but one of those was local government assistance to state and municipalities. And Sioux Falls didn't receive a direct allocation from those funds. We actually received an allocation through the state of South Dakota, so they set aside a portion of their funding for cities and counties. And we were able to submit on a reimbursement basis, based on eligible program costs, reimbursements for certain expenses that we incurred back in 2020. So an example of that, simple ones related to COVID were like our PPE, like our masks and other equipment that we needed to utilize to respond to the pandemic. But they also provided some broad categories such as certain public safety payrolls, certain health payrolls, people that were involved or they termed to be involved as part of the COVID response. We were able to secure those funds and be able to get reimbursed for those.
Okay. Some of people working from home, equipment, were you able to use some of those funds for that as well?
Yeah, so we had a certain amount of technology expenses that we incurred. We kind of went through a rolling period of having people work from home for a certain period, and then people began returning back to the work sites. But we did have some technology costs in terms of broadband access, opening up the portal so we had the ability to have enough traffic coming through, as well as just gearing up, whether it's laptops and so forth, so that we had the ability to work remotely.
And it was about $48 million that Sioux Falls received from the state, and that was federal money.
Correct. So we were reimbursed up to about 48. Our original allocation was 41.5 million, and we were able to come up with enough eligible costs to request some additional to be refunded to the city, and the state was able to provide that support also.
Let's talk about some of the projects that you were able to either allocate the money toward or be, look at going forward.
So getting reimbursed for some of the expenses that we incurred back in 2020 allowed us the opportunity to have those funds then, as they came back in, being able to utilize those for some other purposes. So I think first and foremost, the city was interested in doing something, making sure we are financially stable and having, shoring up our funds and so forth. So the first thing that we brought forward to the council was a request to pay down and prepay about $25 million of debt. And so the council approved that request. That occurred back in last year. So what that allows us to do is having prepaid off a couple of those bonds, it's going to free up money in future years that we can utilize to invest in other projects. So not only are we saving the interest expenses by paying it off early, but all of the things that we would have went toward principal repayment, we can now utilize to pay cash for some other investments in future years. But there was a number of other areas that we worked with the council as well. We kind of started discussions back in December with the council on utilization of some of the remaining funding, and maybe Councilor Selberg would like to talk a little bit about that.
Well, some of the funding, again, the administration, Shawn's team and others were very proactive in coming to the council again months ago and talking about some of the different ways we could use these funds. So we had a very good conversation over the months and came up with a lot of different very solid programs. I think we're all pretty much in agreement. And then us as a council, I think, came in with another idea or two, like Operation Hope Fund, which we touched on this show a bit too. So it was a very, very productive conversation.
There was definitely more projects that were possible to fund than there was funding available. But we're kind of in our first phase of that. We do have some funds remaining. But this first set of projects that were kind of approved by the council, I think in many respects, I think the thing that interested many of the council members and the administration was a lot of the private donations that were also going to help support these. So for example, Jacobson Plaza at Falls Park North, that was a $2 million contribution from the Jacobson family to build a refrigerated ice ribbon, as well as an inclusive and adaptive playground at that area. And then the city's contribution would be $2 million. So those opportunities to be able to turn a few dollars, city dollars, into multiple dollars of investment really were significant. The same thing holds true for the Lions exhibit at the zoo, which they're going to be moving forward with an expansion here over the next several years, and many of the other projects that were brought forward.
So there was private donations toward those projects, which made it possible for the city to put in just, not have to fund the entire project then.
Correct. There was millions of dollars that were put in that the zoo had independently raised in contributions toward the lion exhibit expansion, and the city's contribution was only about $1.4 million for a much more significant project. So it was really exciting to see the community step up. And even with the Hayward Park project, while the city is funding a majority of that expansion to that park area that's very underserved in our community, there was a couple of teams of individuals, including Leadership Sioux Falls and the Promising Future Fund, that went out and is raising funds to enhance the playground. So really very engaged projects with the community.
Yeah, anytime you can get those public-private collaborations, those are the ultimate for sure.
Mm-hmm. Some of the projects that you looked at over the course of the 4 or 5 months on the city council, were you hoping that this would create economic development going forward for the city of Sioux Falls?
That was an aspect, most of it, sure. Yeah, there were a lot of different aspects. I mean, for each project, we could probably break them down in the pros and cons, but that was a big part of a lot of it. What did we have? The ice ribbon. We also had everything from streets. We had, remind me, in a couple of the other ones, we had about 5 or 6 projects altogether.
Correct. Yeah, we placed some design money in for River Greenway, which could lead to significant private investment downtown. So we're moving forward with the design for that, but also $4 million into arterial streets to support the significant growth that we're seeing in the community here over the last year.
Mm-hmm. Sure. Okay. And now moving forward, there's the American Rescue Plan that was adopted. Let's talk a little bit about, do we know if there's any way that we will get any of that money?
So there is some local government assistance dollars that are allocated as a part of that. Almost the complete opposite of how the CARES Act worked in terms of those local government assistance dollars. We should be receiving the money up front, but then we have to prove that we used it for eligible project costs. And so they will have eligibility guidelines for that. Those haven't been fully determined yet. We're waiting for the future guidance to be introduced on that over the next several months.
There are some things that it cannot be used for that we do know that.
Yes, Congress was very clear. Number one, it cannot be used for a reduction of taxation. So if you're receiving those and turning those into reducing taxes for residents, or this includes states and localities, that was expressly prohibited. That's being litigated right now in the court system. And the other piece was pension systems. You couldn't use it to shore up pensions. There are many pensions nationwide that are underfunded and in poor structure. They have been for decades, and those municipalities and states haven't dealt with that challenge. Fortunately here we have a closed city pension, which was over 100% funded as of the end of last year, and then new employees are in the state of South Dakota pension, which is 1-2 in the nation in terms of how funded it is. So we're in a good position there.
With your overall, finance knowledge, how did Sioux Falls fare through the entire COVID-19 pandemic?
Overall, we were very lucky. We did well. I think just the policies that we had from a state and local perspective helped facilitate that relative to our peers. I think we are adaptive to the changes as we learn more throughout the pandemic. Certainly there was impacts for our local businesses, and in some in particular. I think the hospitality sector certainly saw the most significant impact. Restaurants early on, bars and drinking establishments, they're starting to recover some, but they still haven't kind of achieved where they were previously. Lodging took the most significant impact, and as people were not traveling at all and conferences came to an end, those certainly were impacted greatly.
Yeah, I think very fortunate is a good way to put how we came through the year. I think if you had asked us last March or April if we would have taken the numbers we ended up with at the end of the year, we would have happily done that. So, yeah.
All right. Well, great. Well, thank you for the update. We appreciate it. Councillor Selberg, if anyone would like to get a hold of you or if has any questions or concerns, how do they get a hold of you?
SiouxFalls.org. You can access contact information for any of your councilors, for the mayor, departments, anybody you might need.
All right. Well, great. Well, thank you, and thank you for joining us. Thanks for watching. We'll be back next month.